Shelby is our third child. When she was 10 years old, she started seeing floaters in her left eye, and it turned out that it was von Hippel-Lindau. Our entire family was DNA tested, and unfortunately, it came back that I was the carrier. You can go blind, you can get renal cell carcinoma, you can get pancreatic cancer, and you can die from all of that too. And then I found out about the National Institutes of Health. I brought Shelby right away for her eyes. Then she and I became patients. I have been battling this disease for the past 23 years, and I have my testing coming up tomorrow and the next day.
The Clinical Center is the largest hospital in the world dedicated solely to clinical research. We are interested in very unusual problems that haven't responded to usual measures. The patients who come here all have to agree to participate in a research trial.
This is much smaller than what it looked like before, and so we're quite happy about how things are going.
The Clinical Center opened in 1953. And I like to say it was one of the great gifts that Congress has given to the American people. Chemotherapy for cancer was invented at the Clinical Center. The cure for childhood leukemia came at the Clinical Center. Really wonderful advances emanated from the Clinical Center.
We receive patients from all around the country and many parts around the world, and they need a place to stay, especially if they come far away, that they may need to be here for a period of time.
And it became very striking to me when I realized that some of my patients were sleeping in their cars on the NIH campus. When I became director of the Clinical Center, the chief nurse and I came up with the idea, we really need a lodge for the adults. And the first chair of the Foundation for the NIH board was Dr. Charles Sanders. He said, this is going to be our first project. There was a nucleus of funds. It was clear, however, that they didn't have all the money. But Dr. Sanders said, don't worry, I know Lily Safra, and she liked it. She gave the remaining funds to enable the lodge to be constructed.
My husband Edmond created his philanthropic foundation to enhance the dignity of others.
The Edmond J. Safra Family Lodge. It's steps away from the Clinical Center, and it's easy access for the families to be that close to their loved ones.
The hotels are pretty costly here, so it was the most wonderful burden that was lifted from our shoulders. When you walk through these doors, the level of anxiety, anticipation, it's taken down a few notches. Everything is taken care of. Shelby would walk around in the garden, and it was wonderful. We ate out there. She brought her books out there. It was so quiet and
there's something
beautiful.
About the garden here. It's just amazing.
It feels like a
serene.
little. It's very Zen-like. That heals. That heals.
FNIH strives to put patients at the center of everything we do. The NIH Clinical Center is an epitome of the science of medicine, but having the lodge on campus is an epitome of the humanitarian aspects of medicine.
I know from personal experience that when a loved one becomes sick, the world narrows. At those times, helping those we love is not the most important goal, it is the only goal.
Shelby graduated Penn State in 2014.
And we were scheduled for her and my tests right after graduation.
So we came here for her appointments, and unfortunately her brain tumor had grown significantly, and they had to do surgery. The surgery itself seemed to go well. She came out of it. But then, I guess the next day, things started getting bad. She had a stroke, basically, after surgery.
She was supposed to go to University of Delaware for her master's in child psychology. Her boyfriend was going to propose to her. It was like somebody took a bomb and exploded it in front of us, and life was not the same anymore.
We felt it was important to have her name out there. We thought about it and we kept coming back to NIH and the lodge. We thought about a bench. The garden was where we all spent so much time while we were here.
And if someone could go to that bench and read Shelby's name, just that her name spills off of their lips. They don't have to know who she is, but she was a person and she came through these doors. And now these people are getting the care and the warmth that they need to get better and go on. We feel like she's with us all the time. She taught us how to live our lives.
So we had a dedication event for the bench. I thought it was just going to be a little thing, just a few people. And the whole garden is full of probably 50 people, doctors, nurses, technicians.
Everyone sharing stories about Shelby.
That day meant the world to me because it's just everything kind of came full circle and it just reinforced what an amazing place and what amazing people are involved here.
We're thankful, very, very thankful.